Hello, I'm Dr. Bang Jisung, the hair loss expert dedicated to protecting your hair. It's a pleasure to be here. You're familiar with Finasteride and Dutasteride, aren't you? They're marketed under various brand names like Pumo and Amo. These medications are designed to decrease the production of DHT, which is a specific type of male hormone. But simply put, if you think of it this way, there's testosterone, the main male hormone, which then converts into DHT, and this DHT attacks us, making it difficult for us, causing hereditary hair loss. So, it's about how much you can reduce this DHT, and how exactly do we achieve that reduction. Specifically, medications like Propecia, or more generally finasteride-based drugs, primarily work by blocking one very clear and distinct pathway that facilitates the conversion of testosterone into DHT. So, in simpler terms, imagine there are several different pathways and it effectively blocks the primary, most frequented route. So, while it is effective, some individuals may feel a slight reduction in its overall drug efficacy. However, Dutasteride from these many divergent pathways effectively blocks two additional major routes. So, it effectively blocks more pathways. This implies that when testosterone and DHT are present, the amount of DHT produced can be significantly reduced, because it's blocking those ancillary pathways as well. Therefore, if you were to take these medications for the same duration, if finasteride significantly reduces testosterone and DHT to a certain extent, then Dutasteride could lower it even more substantially. And for some people, this small difference can significantly change the treatment's effectiveness. If this person was naturally producing more DHT than usual, and their hair follicles were overly sensitive to it, then it would be absolutely necessary to reduce it to a therapeutic dose. But if the drug treatment continues without lowering it to the effective therapeutic dose, then this individual's hair loss will progress, albeit very slowly. In that case, you get the frustrating situation where hair loss continues even while taking medication. In such cases, it really helps to reduce DHT more significantly. In such instances, we clinically utilize Dutasteride-based treatments as they are considered more effective for their ability to achieve a greater reduction in DHT levels. Since they're different drugs, the dosages vary. The dosage and content don't necessarily have to be the same. Now, the concern is that you need drug efficacy, but you're also worried about side effects, right? So pharmaceutical companies have chosen the most effective dosage with minimal side effects. So there are various dosage strengths available for this particular medication. For finasteride, some people cut the pills, and in other countries, different dosages are available. But for Dutasteride, there's usually only one dosage available. So, regarding the dosage, it's best to adhere to the officially recommended amount. And for the duration, ideally, you should take it for at least a year, as it's typically prescribed for once daily use. Therefore, I generally advise my patients to take it during the night or evening hours. And as for the drug's efficacy, as you know, it works by lowering DHT, so you won't see its effects immediately after you start taking the medication. It typically takes 2 to 3 months for DHT to lower enough to stabilize hair loss. So, viewing it patiently is best. Saying the medication isn't working after only a month is not ideal. You should take a long-term view, taking the medication consistently for at least 6 months, or preferably a year, before judging its efficacy. If you were my patient, I'd honestly tell you to take the medication for a year. Why? I always tell them it's actually more important to check for side effects, rather than just the drug's efficacy. Later, when severe hair loss progresses quickly, many individuals, even those who wish to undergo drug treatment, often abandon it due to intense anxiety and apprehension. In such cases, it's beneficial to take the medication beforehand. If you can confirm, "I'm not sure if it's effective, but I definitely have no side effects," then after a year, if you acknowledge its efficacy, you can simply maintain the treatment. But if you're not sure about the drug's efficacy, you can simply stop taking it. So, after taking it for a year, you knew there were no side effects, but you finished without knowing if it was effective. Then, when you stop the medication, you'll notice some kind of change after 6 months or a year. For example, if your hair suddenly starts falling out more or becomes thinner, then that's your evidence. You can then judge, so the drug was actually effective for me. So, while you might not know if the medication is working while you're on it, stopping it actually gives you an opportunity to confirm its effectiveness. Then, in that situation, you can personally make your own judgment. Weigh side effects against benefits. This enables you to maintain drug treatment more stably, which is how I explain it to my patients. So today we've learned a bit about finasteride and Dutasteride medications. These medications overall offer more advantages than disadvantages. Therefore, I truly hope you will give it some thought, research it thoroughly, and earnestly consider it as a viable option. Thank you.